good morning, or good afternoon, or good evening, depending where you're joining us from, and perhaps even watching the recording of today's webinar. My name is Allison Hoons, and I am an affiliate knowledge broker at Arthritis Research Canada, and I'm a member of the Arthritis Patient Advisory Board. Before we begin, I would like to respectfully acknowledge that Arthritis Research Canada's headquarters are located on the unceded traditional territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. We express our sincere and profound gratitude to the keepers of the land. I'm thrilled to be the moderator for today's webinar, and I'm excited to learn from our guest scientist, Dr. Deborah Da Costa. This webinar is part of episode 9 of the Arthritis Research Education Series, which features research that focuses on cognitive behavioral therapy for insomnia or difficulty sleeping for people with arthritis. If you're joining us for the first time, the Arthritis Research Education Series was created by the Arthritis Research Canada's Arthritis Patient Advisory Board. There's a lot of words in that sentence. The purpose of this series is to show how research can help people living with arthritis. Now, many of you may have already viewed the video for this episode on our website, but if you haven't, I'm happy to say that we're going to play it for you at the end of the webinar. And after this presentation, after Dr. Da Costa's presentation, there'll be a chance for you to ask some questions. There'll be a Q&A session. Now, how do you get your questions to us? Well, if you look at the bottom of your screen, on the lower right-hand corner, there's a Q&A icon, a little button that says Q&A. So please put your questions in there, and there's a really cool function that's a part of that you can upvote. If you like a question that somebody else has asked, has typed into the box, you can give it a thumbs up so that we know that several people would like those questions answered. We're going to do the best that we can to make sure that we answer as many questions as possible. But understandably, we may not be able to answer all your questions, particularly if your question could be viewed as requesting individual medical advice. In that case, it's much better that you ask your questions about your own individual situation with your healthcare provider, as they have all the information about your health. Now it's my pleasure to introduce Dr. Deborah Da Costa. She's an associate professor in the Department of Medicine at McGill University and a scientist at the Research Institute of the McGill University Health Center, and a psychologist at the McGill Comprehensive Health Improvement Program. Her research focuses on the relationships between people's thoughts, their behaviors, and their social environment on their chronic health conditions, especially on depression and sleep. And that's why she's a perfect guest for us this morning. And that's our focus for today's webinar. So without further ado, over to Dr. Da Costa.
Thank you so much, Allison. I'm just going to quickly put up my slides. Great, we're in business. So I will start by giving you a brief overview of insomnia in the context of living with arthritis. I'll talk a little bit about what insomnia is and some of the key research findings in the area. And then I will move on to tips to improve your sleep. Before we move on, I want you to think about the following. What % of people with arthritis report suffering from symptoms of insomnia? And that can go anywhere between 8% to 98%. The next question is, which of the following does not contribute to insomnia? drinking caffeine after 2, not having a regular bedtime, lying in bed and watching a movie, or napping in the afternoon. Now, people often ask me, what is the optimal amount of time that I should be aiming for to sleep? That could be very individual. It depends on the person. There's no magic number. However, sleep experts would argue that we should aim for about 7 hours of sleep. What do we mean by insomnia? Basically, insomnia involves poor sleep quality, poor sleep quantity, basically feeling unrefreshed in the morning. Even after sleeping for 7 hours, some people might still not feel restored. It is also accompanied by difficulty falling asleep, so taking 30, 40 minutes, an hour to fall asleep sometimes. Usually the amount of time it takes to fall asleep is anywhere between 10 to 20 minutes. Difficulty staying asleep is another factor that is comprised of insomnia. So basically waking up numerous times over the course of the night. It's normal to wake up maybe 1, 2 times, but fall asleep relatively quickly. In patients who suffer from insomnia, they can be waking up anywhere between 10 and 12 times over the course of the night and then have a difficult time falling asleep again. So you can see how all that contributes to very fragmented sleep. And it's no surprise that after waking up that many times and having a hard time falling asleep, that one would feel unrefreshed in the morning. Insomnia can also be accompanied by early morning awakening. And by that, I mean waking up, let's say at 4 or 4:30 in the morning, even though your alarm clock is set for 6 or 7 o'clock, and not being able to fall asleep again, or falling asleep right before your alarm clock is supposed to go on. So like 15 minutes before, and that can be so frustrating for people. So these essentially are the main symptoms of insomnia. What we also see in order to be diagnosed with insomnia, these symptoms need to occur at least 3 times a week for a period of 3 months. And they're also accompanied by daytime symptoms such as difficulty concentrating, such as being more irritable. So it really can have an impact on your ability to function at work or at home in terms of your various activities. So how prevalent is insomnia in the course of living with arthritis? Studies suggest that about 70% of adults living with arthritis will experience insomnia at some point. And this is considerably higher than what we see in the general population, which is about 30%. What kinds of factors are associated with the development of insomnia in patients with arthritis? We still need a little bit more research here, but I'm putting up basically the factors which have come out as being pretty consistent in terms of their association with the development of insomnia. So of course, disease-related factors like inflammatory markers, your overall disease activity, pain levels, these can all be associated with symptoms of insomnia. Certain medications may also make you more susceptible to experiencing symptoms of insomnia. Amongst the lifestyle or behavioral factors, we do see an association between physical inactivity and symptoms of insomnia. Among the psychological variables, the variable that comes out, or the factor that comes out as being quite associated with the development of insomnia, is depression. Clearly, one of the symptoms of depression, in addition to low mood and lack of motivation, can be disturbed sleep. But there is a bidirectional relationship, which I'll talk about in a minute. Elevated stress, I don't have it there, but that can also be a factor in the development of insomnia. Why is it important for us to address insomnia in the context of living with arthritis? Well, studies show that when you're experiencing persistent insomnia over time, it certainly can affect your fatigue level. Fatigue is something already that many patients are struggling with. So add difficulty sleeping or disturbed sleeping, that can certainly worsen or heighten the levels of both physical and mental fatigue. Numerous studies have shown that after a poor night's sleep, insomnia can also exacerbate pain. It makes you less tolerant to pain. It increases your sensitivity to pain. So while I said before that pain can contribute to sleep problems can also contribute to worsening pain. So really, it's a bidirectional relationship, which is why it's so important for us to intervene and address sleep. It can also trigger or worsen symptoms of depression and anxiety. So here too, while depression contributes to sleep problems can also worsen depression. In fact, in people who experience insomnia but who are not depressed, studies in other populations have shown that they are actually more susceptible to developing or having a reoccurrence of depression. Again, showing why it's so important for us to intervene and properly address these sleep difficulties. So overall, sleep is one important factor which can contribute to poor quality of life in patients living with chronic conditions such as arthritis. How are sleep disturbances managed in arthritis? Unfortunately, very poorly. Studies show that they are often not well detected. Patients are often reluctant to discuss with their physician their sleep problems. In a needs assessment study that we did with over 300 patients across the country, we found that 58% discussed the problem with their doctor. A large proportion did not discuss the problem. Those that didn't discuss wanted to talk to their physician about it, but they told us that they felt that it was just something that they perceived they had to accept as part of living with their illness. So there wasn't much they could do about it. They also felt that in the past they had discussed the problem, but their doctor didn't really address it very well. And they also felt that they didn't really know where to go with respect to getting some help for their sleep problems. When when insomnia is discussed with a healthcare provider, typically it is commonly treated with medication. 39% of the patients who participated in our needs assessment reported having used prescribed medication to help with their sleep problem. Hypnotics are typically the medication that is most commonly prescribed to help with sleep. The problem is hypnotics are meant for short-term use. They're effective in the short term, but they're not meant for prolonged use. In fact, prolonged use can have a negative impact in terms of not only side effects, such as increased risk for falls, the potential for it to become addictive, but that people become tolerant to these medications, so they stop working effectively. And it really does not address the core of the problem. There are non-drug approaches available, in particular, a non-drug therapeutic approach called cognitive behavioral therapy for insomnia, CBTi, which is what will be referring to from now on. This is actually considered first line by sleep experts, including the American Academy of Physicians, for the treatment of insomnia. In other chronic conditions, such as cancer, and in the general population, CBTi has been shown to be beneficial in terms of improving sleep outcomes or disturbed sleep. And these benefits, long-term studies have shown, are sustained for up to 2 years, which is quite interesting compared to the benefits or lack of that we see with prolonged use of medication. What I find also very interesting is that these studies have shown that in addition to helping with sleep, they also, CBTi, so remember, this is a therapeutic behavioral intervention specifically targeting insomnia, but it has also been shown to improve symptoms like pain, fatigue, and depression, which we know are also quite prevalent and sometimes not very well managed in people living with arthritis. So it's like a cluster of symptoms that tend to go together, which potentially may be alleviated by CBTi. This is what the research tells us in other populations. We are now in the position of hoping to test this in patients with arthritis. So what does CBTi involve? It is usually delivered in between 6 to 10 sessions. It involves education about sleep, how sleep problems start, why they are maintained. It involves looking at certain sleep practices, what we call sleep hygiene, that can be used in order to promote sleep. It involves stimulus control, and I'll talk a little bit more about that towards the end, but this is basically trying to strengthen the link between your bed and sleep. And importantly, it also involves looking at what kinds of unhelpful thoughts or beliefs that you may have about sleep that are actually serving to make the problem worse, that are actually having a negative impact in terms of you being able to fall asleep. So thoughts like, after a poor night's sleep, I know it will interfere with my daily activities on the next day. So really lying in bed and ruminating and worrying about that. Of course, that is not conducive to falling asleep, but the approach involves identifying what sorts of perceptions you have that you may be catastrophizing or ruminating about before while you're lying in bed that are only serving to maintain the problem. Traditionally, CBTi involves face-to-face sessions. So as I said, anywhere between 6 to 10 sessions. It's costly, mostly it's not covered by Medicare. It involves repeated visits to a provider. So there's accessibility issues. And one of the things that we know is that there is a shortage of experts certified in delivering CBTi across the country. To address this, and that isn't only here, we see that in other parts of in North America as well. So to address this, in the last, I would say 5-6 years, we have seen an increase in internet-delivered CBTi. So this is self-guided. The person does this through the internet in a structured way. And studies have shown in the general population and in specific medical conditions such as cancer that the benefits are equivocal to what we see with face-to-face delivered CBTi. So this is what got me very interested in taking one of the programs that has already been proven to be shown effective. So we will be tailoring and adapting a CBTi internet-delivered program that was developed by Dr. José Savard over at the University of Laval. And we will be testing it on 52 patients with arthritis to get their feedback and to see if we see some preliminary signals that it indeed is helpful in terms of improving sleep. When we did our needs assessment with arthritis patients, I was very pleased to see that about 90% of patients who were experiencing insomnia reported to us that they would be willing to try CBTi over the internet. And this was even higher than what we see for CBTi delivered with a healthcare professional face-to-face, and higher than willingness to try medication. So tips to improve your sleep. This is what we call sleep hygiene. It's things that you should do or use regularly in order to help you better sleep and to feel more refreshed in the morning after you sleep. Firstly, protect your need to sleep. ensure that, if 7.5 hours or 8 hours is your target where you feel refreshed, make sure that you are setting aside enough time to get that amount of sleep. If your wake up time is 6 o'clock and you're going to bed at midnight, then you haven't set the amount of time you need in order to get your optimal amount of sleep. You may want to change your bedtime. Keep regular sleep hours. Go to bed at the same time each night. Wake up at the same time each morning, plus or minus 20 minutes. On the weekends, try not to sleep in more than an hour or go to bed more than an hour. I know it's difficult to initiate, but really, if you are having sleep problems, it is important to keep a regular sleep schedule. Now, COVID and the pandemic and the restrictions did a lot to alter people's sleep schedules, with people going to bed later because they were working from home. They didn't have to have the commute time, so they took advantage of that. And now that has caused problems in terms of people trying to get back into their usual work schedules in whatever their places of work is, and now suddenly having to change their time. A lot of people are feeling sleep deprived because it takes some time to get used to a new schedule. Get enough daylight. Daylight is important in terms of our sleep patterns. I know with the winter and the temperature changing, it can be a little difficult or challenging, but if you're unable to go out, open your blinds. Don't wait until noon to do that. Do that as early as you can when you wake up, and try to expose yourself a little bit to that daylight coming in from your window. Caffeine. It's important to try to control how much coffee we're drinking. Coffee is a stimulant, and really, if we're consuming it later in the day, it can interfere with your ability to fall asleep or stay asleep. If you do drink coffee, no more than 3 cups of coffee, and that's 8 ounce, not these extra size coffees that we see in a lot of shops. So again, not more than 3, and try to avoid not consuming caffeine later than 2 o'clock in the afternoon. Be mindful of alcohol. People will often say, sometimes I need to have a glass of wine to help me fall asleep. That really is not a good habit to be getting into. Alcohol has other negative health effects if one is not mindful about how much you're consuming. And what studies have shown is that while it might help you fall asleep faster, it does have an impact on the quality of your sleep, and it does have an impact on your ability to stay asleep. So sleep disruptions can be more common when consuming alcohol, and that deep sleep may be impacted. For numerous health reasons, one should avoid smoking, but like caffeine, it is also a stimulant and can have a negative impact on your ability to promote sleep. Napping. Now, this is always an interesting one because often my patients tell me that I need to take a nap. There's no way I'll be able to get through the rest of the afternoon and my evening if I don't take a nap. So clearly, yes, a nap for some people is something that they need to do. It helps them get through the day. So I'm not saying that you should not nap. I'm just saying that sleep experts recommend that you should not nap too much later in the day. So try to do it in the early afternoon, and try to nap again, early afternoon and short naps. So not more than 30 minutes is what is recommended, so that it does not interfere with your ability to fall asleep or stay asleep later at night when you are ready to go to bed. Exercise. This has also been shown to help with not only promoting sleep in terms of falling asleep, but staying asleep and having a deeper quality of sleep. What is recommended is 30 minutes of moderate intensity exercise. And while earlier on, the recommendation was that we should avoid moderate exercise within a few hours of going to bed, the more recent studies actually indicate that moderate exercise any time of the day does not negatively impact your ability to fall asleep. So even if you do it within a couple of hours of going to bed, it shouldn't be a problem. Vigorous exercise, on the other hand, such as hiking, such as jogging, this is more vigorous, and studies show that we should avoid doing it within an hour of bedtime because it may have a negative impact in terms of your ability to fall asleep. So I'm not saying you shouldn't do it, I'm just saying be careful when you do it so that it doesn't have a negative impact on your ability to fall asleep. Avoid eating too late. Of course, you don't want to go to bed hungry as well. So if you are feeling hungry before going to bed, choose something light and something healthy. Winding down before going to bedtime is very important. Do something that's enjoyable, something that you find relaxing. Try to engage in this type of activity for at least 30 minutes before going to bed. Staying up, working late, and then closing your laptop and thinking that you're going to roll right into bed and fall asleep, it's unlikely because your brain is not telling you that you are in the right mindset in order to fall asleep. Practice relaxation exercises. People always ask me which one should I do, which one is the best one to help with sleep, and there's no real answer to that. It's more individual. Practice different ones and see which one you like better in terms of the feeling you get afterwards in terms of relaxation. Mindfulness, mindful meditation is something that is often used. Progressive muscle relaxation, which involves tensing and relaxing various muscle groups in your body. Guided imagery, lying in bed, thinking about a place that you've been before that you have found very relaxing. Think of the sights, the sounds, the smells associated with that place and really block out everything else. That can be very soothing and very relaxing and can help promote sleep. Deep breathing, which involves taking deep breaths for 10 to 15 minutes, can also be very relaxing. There's some good apps out there with various types of relaxation exercises that you may want to try and see if that helps you with your sleep. Now, the thing with relaxation exercises, similar to exercise, it requires you doing this for a couple of weeks before you see effects. So if you don't get that benefit in the first few days, don't be discouraged. It takes some time and to actually see an effect. And, you know, preferably do it at night, but if you're unable to do it at night for whatever reason, even during the day, engaging in these types of relaxation practices can still be beneficial in terms of bringing your stress levels down, which we know can have a negative impact in terms of promoting good sleep. Make the bedroom quiet and comfortable. Block out light and drown out disruptive sounds. Have a comfortable bedding, mattress. It's important that it be on the cooler side. Again, people are variable, but sleep experts suggest somewhere between 18 to 20 degrees. Reassociate your bed and the bedroom with sleepiness rather than wakefulness. Use the bedroom for sleep and intimacy only. No watching TV, no working. This isn't the time to get into a heated argument, and it's not the time to worry about everything you need to do tomorrow. If you're unable to fall asleep after 20 minutes, get out of bed, go into a different room, stretch, read something that's not too stimulating, or do something else that is calming in a low light before trying to go back to bed and falling asleep. Now, again, COVID, the pandemic, the restrictions really had an impact for some people with respect to associating your bed with sleepiness, because for many people, their bedroom also became their offices. And that is really not conducive to promoting what is shown to be so important that, you know, the bedroom should be a place that is just for sleep. So bear that in mind. And one of my most important recommendations is turn off your cell phone and other electronics at least 30 minutes before going to bed. This is happening so much now, not only in our teenagers, which the problem started there, but now I see this in a range of age groups where people are on their phones or on their tablets, lying in bed before going to bed. And this not only because blue light is emanated from these devices, which can have an impact in terms of decreasing melatonin levels, but it's also stimulating. You know, answering emails before going to bed, or watching you know, different types of things on social media, which can get you sometimes aggravated or have all different emotions rise up in you, is not conducive to falling asleep. We should really do something that is more relaxing to really get you in the mindset of promoting good sleep. So if we go back to the questions I started with, what % of people with arthritis report suffering symptoms of insomnia? 70% at least, based on the research. Which of the following does not contribute to insomnia? Napping in the afternoon is okay as long as you do it earlier in the afternoon and not more than 30 minutes. So I hope I've convinced you that sleep is an important part of health and wellness. Like good nutrition, like being physically active, this is an important part of well-being. We need it in order to feel refreshed and be able to go on with our day. Non-drug interventions are available. We are designing and testing CBTi delivered over the internet for people living with insomnia, people living with arthritis who are experiencing insomnia. And try to regularly use these habits that can help promote good sleep. And I'm ready for questions.
Thank you, Dr. Da Costa. That was a wonderful overview, both in breadth and depth, for us to be aware of the factors that influence our sleep. For myself personally, it was very helpful to hear what normal is. So for example, 10 to 20 minutes to fall asleep. I had no idea of what that normal range was. And waking once to twice a night is normal versus 10 times. I knew people woke during the night and just assumed that that was normal if it happened a few times. So that's really helpful. I see there are a couple of questions in the chat box, which in the Q&A. So please remember to type your questions into Q&A. And where you see the little thumbs up icon, if it's a question that you would also like to see answered, please feel free to click on that. So the first question is from Heather, and she asks, what are some examples of hypnotic drugs, the names of the drugs that are hypnotics?
Well, they're under benzodiazepines, also called Z drugs. Basically, I mean, I don't know the names of specific ones, but they're benzodiazepines, and the new class of non-benzodiazepines are also called Z drugs. Thank you.
Then we have one attendee who's asking, will there be a recording of this webinar? Yes, most definitely. That will be on the website. Please check the website for when that will be loaded. Pat mentions, it's not a question, but just that she finds that if she doesn't get her nap, her body is tense and it's harder going to sleep. Is that something that you see often in your practice, Dr. Da Costa?
Yes, I mean, certainly I have to say that when I started in the area of sleep, let's say 20 years ago, the sleep experts were adamant against naps, but I don't think they had any concept of insomnia when you living with a chronic condition. So we had to sit them down and say, our patients are telling us that they can't go without a sleep. There has to be, without a nap, there has to be some sort of accommodation. We need to understand that it's not a one size fits all, and that we're talking about people living with a chronic condition who have fatigue and who have pain. So the consensus has changed over the years. And definitely, this is where the recommendations came that we're not saying that you shouldn't take a nap. In fact, it can be very helpful in terms of helping with your pain and your muscle fatigue. It's just try not to nap for too long.
Okay, thank you. So a too long might be
more than 30 minutes.
More than 30 minutes. Okay, great. Question here about can you please provide some suggestions on managing sleep while in a flare and in prednisone? So I can certainly relate to that. Prednisone is a great, seems to be a great stimulant. It makes it difficult to sleep. Do you have any advice in regards to in a flare or with medications which may be stimulating?
Yeah, I mean, again, it's trying to be mindful of, are there any habits that you have incorporated into your lifestyle in order to better manage sleep that end up being counter-effective? So I usually have my patients keep a diary of what medications they are on, whether or not they're in a flare, how much pain they have, and then other health habits, like are there any other things that they are doing that they're doing to try to compensate, but is actually backfiring on them? Like maybe they've started to consume more coffee. And that's, so it's, because those things we can't modify, we have to kind of wait it out in terms of the flare and in terms of the prednisone. But are there any things that we can identify that we could perhaps modify in order to help, such as caffeine, such as, doing something that, taking longer naps? Instead of napping for that long, can you maybe go on a comfortable couch and just lie there and take a good rest without falling asleep?
Thank you. And I love the suggestion of keeping a diary because when you're fatigued or when you've got brain fog dealing with pain, it's difficult to remember what has happened and be able to share that with your healthcare provider. Yeah. So thank you for raising that.
Yeah, a lot of times patients find patterns that they would have never been able to find without keeping the diary. So it could be very informative. You might have not even noticed that you consumed that extra cup of coffee.
Indeed, especially when you're distracted watching something. Gloria asks, does an e-reader count as distracting for sleep as well? Because some of us, like to read before we go to sleep, and it might be harder to hold a book and turn pages versus an e-reader. What are your thoughts about that?
Again, if you're not experiencing sleep problems, then I would say no. But if you are, you might want to try and see what happens if you don't use the e-reader, and see if that is a factor. If it has no impact, then I would suggest you continue with it, especially if it's something that you're reading that's relaxing, that helps you put you to sleep, then it shouldn't be too much of a problem.
Okay, so it's kind of a soft recommendation, depending. Okay, and then you did mention about the CBTi courses that were available online. Do you have any? You said that there's not many available. Do you have any ideas of where we can find those? Where would we look for those?
The internet delivered. Well, we're going to be launching a study soon that is going to be testing CBTi over the internet, tailored for people with arthritis. The other ones are either in cancer or in the general population. From my last check, nothing was available in Canada. You had to be either living in the US or the UK in order to have access to the two programs that are currently available and have been tested in the general public.
Okay,
And
well,
I checked about a month ago and I got an email back that it is currently not open to Canadians.
well, this is leads right into the great segue into the next question from Kareem saying, how do I sign up to be a part of the CBTi study?
Right. So we are in the process of getting final ethics approval to do the study. And as soon as we have ethics approval, we will be ready to launch the study. We will be posting information on Arthritis Research Canada's website. We will be recruiting across Canada. So people will have an opportunity to sign up over the internet. And once you sign up, you will be contacted by one of our staff members for a brief interview to determine eligibility. And there you go.
And how many people would you be looking to recruit? Because I suspect there'll be a lot of people like myself that would be interested.
So this is a pilot study, and a pilot study means it's a small study where we want to kind of tweak out any of problems, get feedback back from our patients, see if it's acceptable. So we're looking to recruit 52 patients. It's a randomized pilot study, means there's a 50% chance that you will be in CBTi, 50% chance that you will be in a waitlist control. So it doesn't mean you're not going to get it, it just means you're going to get it after our final assessment. But everybody will have a chance to use the program.
Terrific. We look forward to seeing that call to contribute.
Yes, we hope to have the same enthusiasm.
And there's a question here in regards to cannabis and the effect of cannabis on sleep. Your thoughts about that?
My thoughts about that is I think that in 2 or 3 years, we will have more evidence based on the efficacy of cannabis for sleep. There are some studies coming out showing that it may have some benefits, but from what I remember, those studies have not specifically been conducted in terms of a randomized clinical trial with arthritis. The thing about cannabis as well, from anecdotal evidence from my own patients, is that people respond differently. So for some people, it may help induce sleep, but I've had patients who've had the exact opposite effect, and they're up until 4 o'clock in a very anxious state. So there are individual differences. We also don't know what the amount is. We don't know what amount of cannabis is helpful in terms of inducing or promoting sleep. There's likely individual differences. So I think we still need to know a lot more. And those studies will likely be coming out shortly in the next few years.
There's several questions here about cannabis, and that leads to a follow-on. Is there any direction as opposed to oils versus edibles? Is there anything from the literature to guide us in that way yet?
I haven't seen anything definitive in that way yet.
Okay, thank you. I'm just scrolling to see what other questions. Oh, there's some questions about exercise and the suggested amount of time. You did say about 30 minutes of moderate intensity.
Right.
Do you have any direction on what moderate looks like and what types of exercise are most beneficial?
Yeah, that's a great question. So the types of exercise, and here I'm referring to literature in arthritis and in the general population, because there's more done in other populations, but the types of exercise, really what the experts tell us is anything you find enjoyable. So it could be walking, it could be aquatic types of exercise, even yoga. There are studies showing that it can be helpful in terms of promoting sleep. So basically something that you like that you can do on a regular basis. And what it looks like in terms of moderate, kinesiologists I work with often tell me if you can talk, if you can carry on a conversation, it's moderate. If you find that you're out of breath and you're unable to carry on a conversation, then it's likely too much.
Excellent. That's a great guideline for us that is easy to monitor.
Yeah, exactly.
So there's a question here about menopause, the difficulty sleeping with menopause. Can you speak to some of the differences in sleep challenges in men versus women and across the lifespan, different ages?
Right. So there's not a lot of research specifically on sleep problems with men who have arthritis, just because we usually don't get enough men in these research studies to be able to do any good analyses to look at differences. Women are more likely to participate in research studies. But in the general population, there is some suggestion that women are more prone to insomnia compared to men, particularly in certain lifespan areas such as menopause, where we do see decreases in estrogen and progesterone, which may have an impact on sleep. But remember, menopause, women are also more vulnerable to depression during that time. So there's a combination of both psychological and hormonal factors that come into play, which may have an impact on increasing susceptibility to insomnia. Another critical time point that we see increases in insomnia is during the perinatal period. So during pregnancy and in that first year postpartum, we also see increases in insomnia related to, again, hormonal changes, and women are more vulnerable to depression during the perinatal period as well. So there's usually a combination of both.
Not to mention the baby kicking, as well as the baby needing
The discomfort
in the middle of the night.
Yeah, exactly.
People are commenting about things that they that affect their sleep, such as finding it difficult to turn their brain off, or the noise of the CPAP machine. Some people are commenting that they have a CPAP machine. Are those issues, are those questions that need to be addressed as an individual, or do you have any in their conversations with their own healthcare providers? Or
yeah, especially with the CPAP machine, they should talk to their doctor about that to see if there are any specific things that might be helpful to deal with that. The other one before the CPAP was what again?
Was turning off my brain.
Oh, turning off your brain, yeah. So this is why the relaxation exercises can be helpful to help turn off your brain. So trying to, the guided imagery example I gave is usually a good one to kind of shut down all those thoughts that are going through your mind about tomorrow, and everything you need to do is just kind of, and of course it's normal that, you might say, I've tried it before, but those intrusive thoughts still come in. That's normal. It takes practice. If those intrusive thoughts still come, just let it go, accept that it's happening, but try to redirect yourself back to whatever it was you were thinking about. Don't be discouraged, because if you're new at doing relaxation types of exercises, it takes practice.
Right. There's so many great questions, and we're not going to be able to address them all. I'm just looking at the time because we have some other things, so I'm going to do my best to see if I can sort of lump some questions together here. There's questions about caffeine, wondering if decaf is okay, and that also is linked to the question about what about chocolate? There's caffeine in chocolate. Do you have any advice about decaf on chocolate?
So from my understanding, decaf is fine, but chocolate does contain caffeine, and that does go into the amount that we should be not consuming. So if you're having chocolate before going to bed as a snack, that's probably not a great idea. I don't know how much chocolate, but it's something that, if you need to have that, you should be having it earlier in the day. So definitely, certain soft drinks that have caffeine count, teas count as caffeine, unless you're having herbal teas with no caffeine. So be mindful of the caffeine consumption.
I love some of the comments in the box here too about husbands snoring and dogs taking up space on the bed. Those are hard issues to deal with.
Yeah, those are hard issues.
Do you have any recommendations regarding mattresses or beds for people with arthritis?
I must say I don't. It's really not in my area of expertise.
You can certainly address those questions to physical therapists and occupational therapists, because I'm a physical therapist myself, and that's certainly something that your physical therapist or your occupational therapist can help you with, because there's different kinds of mattresses for different kinds of needs. So there's not one global arthritis mattress. So have that conversation with your physical therapist or occupational therapist. There's a question about after your study that's coming up for CBTi, do you think that this is something that will be more accessible for people? Is that the plan?
The next plan would be what we call a phase 3 study. We're going to do it in a large population across the country. So we need to get funding for that first. But the idea is to test it alongside routine rheumatic care, to kind of see it becomes something that can be easily implemented in terms of, they have a discussion with their healthcare provider. Here's an evidence-based program that can be done over the internet, and really that would be a great way of having it easily accessible to people experiencing insomnia alongside arthritis.
Thank you. There are a few more questions in here that really I can see that it's a struggle. Individuals are struggling with significant life events that are impacting their sleep. And there's questions about medications and significant life events. I think that those are, again, questions that are probably addressed better in conversations with your personal health care provider who has full access to your medical history. So if we're not answering those questions, I hope, I apologize, but I also know that those are probably best addressed in personal conversations. And I think we have time for just 2 more. Let's see if I can get. What about things like podcasts, white noise, rain, sounds of rain? Is there any research about these other things to help with distraction for sleep?
I'm not aware of research that's been done on those types of things. However, I do recommend those things to my patients because many of them have told me that they find that very soothing and helps, again, blank out all those intrusive thoughts. So, some people find that very helpful in terms of putting them in that relaxing mindset to fall asleep.
Thank you. And the final question here is, will you be emailing information about the study? Where can people find out information about the study? How will you be sharing that information?
Through Arthritis Research Canada. We will have information there that they will be able to link on in terms of current research studies. So they will be able to link them to our coordinates and putting in the information they need, so that we will contact them to provide them with further information and to enroll them if they're eligible.
Thank you. Dr. Da Costa, we sincerely appreciate the time and the effort that you put into preparing such a wonderful presentation for us, sharing it with us, and then addressing the questions. It's now time to share the video that's on the website. So I'm just going to be turning off my camera and just while the video is playing, and then we'll have some wrap-up words.
It's my pleasure. Thank you.
As a little girl, I was in so much pain and I just got tired of complaining. And I would just curl myself up in a little ball and just wanted to go away. My name is Corrine. I've been living with juvenile idiopathic arthritis since I was 5 years old. Growing up, I had a really regiment schedule, if you will. Monday through Friday, I'd be at physiotherapy for an hour, hour and a half, even before I went to school. And so a lot of I find it's just like learning just to take it easy, get my sleep, my eating habits, ensure my environmental is like there's not as much stress. Sleep affects persons with arthritis a lot more differently than someone with non-arthritis, or if you will, or someone who's not diagnosed. When like struggling with arthritis and sleep, if I'm not having enough sleep, and then sometimes even I have like a lot of sleep, I'm still not functioning.
Typically, for someone to be diagnosed with insomnia, they need to be experiencing symptoms of either difficulty falling asleep, staying asleep, and also feeling unrefreshed. And these symptoms need to be occurring every other day for at least 2 weeks. And what we see is that when people start developing insomnia, the symptoms tend to persist quite a long time, anywhere between 6 months to a year. This is what we call chronic insomnia, and chronic insomnia, studies show, tend to be occur more frequently in people who have chronic conditions such as arthritis compared to in the general population, where they may subside within a few weeks.
And I'm always looking for new ways. I'm always wanting to learn and or research new ways, to help, relax myself, or just to bring my, condition in stabilize, remission side. I believe in and support research 100%.
The first line of treatment for insomnia is actually what we call cognitive behavioral therapy for insomnia, also known as CBTi. CBTi is what sleep experts recommend. It is a behavioral type of intervention. There's no medication involved. Basically, it involves learning new strategies, new behaviors, new ways of thinking about your sleep that really can help promote sleep. The problem is CBTi is not widely available. There's not many experts across Canada who are trained to deliver CBTi, so accessing it is really a challenge. So we were going to be testing it on 52 patients with arthritis who have sleep difficulties. This research is that, given the findings that we obtained from the needs assessment, we are in the process of tailoring the program, and then we will be testing the program in a small pilot study. Ultimately, we hope that this research will provide an evidence-based program so that patients can learn to better manage their sleep problems. It will be a program that will be accessible, delivered over the internet, completely self-guided, and we hope to see that these symptoms of sleep will not only be improved, but we'll also see improvements in other symptoms that tend to cluster together around sleep, such as fatigue, such as pain, such as depressive symptoms.
Having arthritis and coming across a program regarding sleep and help me learn, manage, better understand would help me function. I feel like we're burnt out due to lack of sleep. And so better understanding sleep and the role it has on our health condition, I believe would create more longevity in life.
Oh, that's such a powerful video. Thank you so much. And I want to extend our appreciation to Corinne, who's also on the Arthritis Patient Advisory Board, for being being such a large part of that video. So again, Dr. Da Costa, thank you for your time today. I also want to thank all the participants, and those that are watching in real time and those that are watching the recording, because that you attending is what this is all about. So we sincerely appreciate you all being with us. We will be sending out, there were still more questions about the study, and we can send out an e-blast about the study when it is ready to roll to all those who have registered. So thank you for joining us today. You will get a quick survey that we ask that you take a few minutes to complete. Your feedback helps us to develop future education series episodes like this. And as an extra bonus, everyone who completes our survey by November 30th will be entered into a draw to win a $25 Starbucks card, which, remember, you should drink earlier in the day and not just before when you go to sleep. We would also like to thank our sponsors for their support. Fresenius Kabi Canada, Janssen, Organon, Teva Pharmaceuticals, and Vitaris. And again, a special thank you to our presenter, and we are grateful to have this opportunity to share your research on addressing sleep problems in arthritic disease. If you haven't had the opportunity to visit the website, please do so. Check out the Arthritis Research Education Series. I encourage you to do so at arthritisresearch.ca/learn, because this is all about learning. We have many episodes on a variety of topics, as well as information on more research that Arthritis Research Canada scientists have undertaken. And there's a frequently asked questions area. There's a wealth of information. So again, thank you to you all. Thank you to the people who helped put this work together for us today, and wishing you all a good afternoon and a good night's sleep.